My mission is to ensure that the wonderful treatment that is received here can be replicated across the state, because you shouldn't have to live next to an extraordinary facility in order to have access to care in our state. The reality is that those with limited financial resources need access to health care because it benefits not only them, it benefits our city, it benefits our counties, and it benefits our state. Health care is about not only the physical health, it's about the economic health of our state. It's about how we create and retain jobs. It's about access to education and the quality of the education that's received. And it's about criminal justice reform. If we want to make our cities and our counties safe, we have to have access to health care. I've spent the last few weeks rolling out 7 pillars for how we improve health care in the state of Georgia, and I'm excited today to roll out our final 3 pillars. First is one that's very personal to me, and that's mental health care. I've told many people the story of my brother Walter. Walter is a young man who's brilliant and dynamic and kind, went to Morehouse College, but dropped out because of a drug addiction that was stronger than his ambition. And Walter wandered for years in and out of rehab treatment centers. But it wasn't until he was imprisoned for the first time in 2014 that he was diagnosed as bipolar. And the reality is Walter's story is not new. Across the state of Georgia, the #1 provider of mental health services is our prison system. And while Walter went to prison in Mississippi, Walter's story happens in the state of Georgia day after day. And I want to make certain that Georgia does better by those who need our help, because they need treatment, not incarceration. Now, this is not to say that public safety isn't important, and my brother went to prison because he committed crimes and he should be held accountable. But we are also accountable for making certain that those who need help and access to services can get those services in the state of Georgia. But right now they cannot. Georgia is ranked as the 8th worst state in the nation for access to mental health care. We know that 1/3 of our counties do not have a licensed social worker. Half of them do not have a licensed psychologist. And absent the kind of care and treatment that they need, those who need access to mental health services often find themselves incarcerated instead of supported. But with the expansion of Medicaid in the state of Georgia, we can finally invest in their full health, not just physical health, but the mental health. That will help reduce, #1, our incarceration rates in the state of Georgia. It will help improve the employment rates. We know that people who are healthy in body and mind do better, and it benefits all of the state of Georgia for that to be so. I want to make certain that mental health care in the state of Georgia has no zip code. #2, I want us to make certain that we increase access to treatment not only through Medicaid expansion, but through recovery-oriented care. That means using the services and the processes we know work across the state. I was talking to I want to call him Dr. Grandy because he acts like a doctor. But as the head of this hospital, I talked to him about the fact that they're adding psychiatrists here because they know that the whole health of the people they serve cannot be treated if the whole person does not get access. We also have to encourage telehealth. I was down in Plains, Georgia at the Mercer Medical Clinic at Plains, and they are excited to have a telemedicine bay where they can connect with psychiatrists and psychologists to gain access for those who need that care and that support. But it's also about increasing more and more the training opportunities in our systems. When I talk about creating 22,000 apprenticeships across the state of Georgia, it's not just about skilled labor. It's about those support systems in our community-based health systems, making sure that no matter where we are, we have people who can identify and provide access to support. But it's also a job creation opportunity because Georgia does not have enough mental health professionals in our state, and as the next governor, I will solve that problem. And this will also make our schools safer. We know that mental health care is directly linked to violence. Although not everyone who's mentally ill is violent, and not everyone who's violent is mentally ill, but we know too many of our young people go untreated and unsupported and unfortunately act out. We can address that issue by making certain that health care, mental health care, is a part of the prescription for the state of Georgia. But the second pillar that we're going to talk about today is senior citizens. Georgia has one of the fastest growing senior populations in the nation. In fact, in the Southeast, the only one that beats us is Florida, and I think that's a law. Other than that, we know that Georgia has a fast-growing population, and that population deserves to age in place. And that is about health care. It's about making certain that when Medicare forces you into a nursing home because Georgia has not invested enough in Medicaid to allow for in-home health care. I want to be the governor who makes certain that aging people can age in place, that they can get access to in-home health care, that they can go to assisted living, and that they are not forced into nursing homes before the right time. But it's also about making sure that they can get access to transit and transportation. And we know that not everyone needs to be in an ambulance to get to the support they need. That's why I want us to increase our paratransit opportunities throughout the state of Georgia, ensuring that you can get, as a senior citizen, get to your non-emergency preventative care appointments and that you can get the help you need when you need it. We know that if we can go beyond covering nursing homes by expanding Medicaid in the state of Georgia, we can ensure that people can age in place, age gracefully, and age productively. That means also strengthening our commitment to the Aging and Disability Resource Centers throughout the state of Georgia. They offer critical connections between community and services, and we have to put more investment there. It's also about investing in community-based home health care opportunities, making sure that home health aides, delivered meals, and personal care homes and personal care needs are provided. I also want to make sure that we expand insurance opportunities for younger seniors who are too young for Medicare but need access to health insurance today. And that's another reason Medicaid expansion will always be on my list. Lastly, I want Georgia to take the lead in a disease that has hurt my family and has harmed families across the state, and that's the disease of Alzheimer's. In the state of Georgia, more than 140,000 seniors live with Alzheimer's, and more than 500,000 Georgians are engaged in trying to provide their support, either through research, through treatment, or parents and adults who are staying home with their aging parents, trying to make certain that they have a high quality of life. We have to take advantage as the state of Georgia of our research institutions and our leadership and become the leader in Alzheimer's research for the nation here in the state of Georgia. We have to help our seniors. We must invest in mental health care. But our third responsibility is those who are disabled. Georgians with disabilities deserve our support, they deserve access to services, and they deserve to come out of the shadows. Too often their needs go unaddressed, and they cannot be addressed because it's often more than what a family can afford. We need more responsive public programs to meet their medical needs, but also to make certain that they are part of a whole community. My plan will protect Medicaid so that more than 330,000 Georgians living with disabilities can get medical care, long-term care, home and community-based services. But it's also about supporting the aging and disabled resource centers, especially the Centers for Independent Living. They've asked for only $1 million more so they can serve the populations, and I want to be the governor who invests. I want us to fully leverage those funding on the federal level so that our children who have special needs get the support that they need, especially those who are physically disabled. But we also have to make certain that we ensure that the disabled community is at the table when we're having discussions about policymaking, because we cannot make decisions without understanding the consequences. I'm talking about health care across the state of Georgia because we know that health care can either be our salvation or it can be our detriment. And unfortunately, for the last few years, Georgia has gone the wrong way. That's why we've lost rural hospitals. It's why we are seeing skyrocketing costs and loss of service. It's why Georgia is falling too far behind. But under my administration, we are going to make healthcare the #1 priority because it's a priority for jobs, for education, and most fundamentally, it's the answer for our people.